Welcome to Prescription for Primary Care. I'm Stephanie, and today we're continuing our exploration of Canada's primary healthcare system. At Healthion, we're working on improving public primary care, and we're always looking for insights from patient advocates and those with firsthand experience navigating our healthcare system. Today, I'm excited to be joined by Karen Malkin-Lazarovitz, founder of the BRCA Sisterhood and EMPOWERink. Karen is a dedicated advocate for women and men's health, particularly in the fight against hereditary cancer, and her work has been featured in Inc. magazine, Chatelaine, CBC, Global News, and BuzzFeed. Karen, thank you for joining us.
Thank you for having me. I'm super excited to be here.
We're super excited to have you on as well. Karen, your journey began with your father's positive BRCA mutation test. Can you tell us about the moment and how it led to your own genetic testing journey?
Sure. So it started 15 years ago. I didn't know anything about hereditary mutations, and my father's first cousin ended up being diagnosed with ovarian cancer, and he reached out to me saying, hey, there's some type of cancer mutation that I might have, so I'm going for a blood test. And really, I knew nothing about it. So I started doing some research, and I realized that with cancer genetic mutations, you get 50% of your genetics from your father, 50% from your mother, which is why this mutation ended up coming from my father. So my father went testing for this mutation and he tested positive. And what that meant is I had a 50% chance of inheriting this mutation, which put me at a very high risk for certain cancers. I knew his appointment for his results, and I called 3 times and he didn't answer. So I knew it was positive, because in my mind I was thinking if he was negative, the appointment would be short and he would answer right away. So I found out that he was positive for this mutation, knew that I had this very high risk, and didn't want to take the chance of getting cancer in my life.
And just a question, how easy was it for you to find these answers about genetic testing or finding out about the BRCA gene when you're doing your research?
So it's easy when somebody in your family has already been diagnosed with a cancer, because as soon as you've been diagnosed with a cancer, if they're looking for a mutation, they know where to find it because there's already cancer in your system. So once they see that there's a hereditary cancer mutation in your family, oftentimes the hospitals throughout Canada will be able to get you into the system to go for testing, because they know that you have a 50% chance of inheriting this mutation. If you're someone who's just curious, it's a little bit more difficult to get those tests, because the health system looks at your family history as well as other factors. So you have to sort of have a family history of certain cancers for them to actually consider you to be eligible to be tested.
I see. And for our listeners who might not be familiar, could you explain what BRCA mutations are and why they're significant for women and men?
Sure. So the first thing I want to say that BRCA mutations and other hereditary cancer mutations only affect 5 to 10% of the general population. So it's important that people aren't afraid. That being said, what it is everyone has cancer genes in their body. So everyone has a BRCA gene. The BR stands for breast. The CA stands for cancer. And what BRCA genes do in most human bodies is they fight off tumors that enter into certain parts of your body. So if it's a breast cancer, if tumors are entering in your breasts, this BRCA gene fights them off. With those who have a mutation, that BRCA gene is broken. So I always say it's like a break in the matrix. So what happens is these tumors that enter in are not able to be fought off properly because my BRCA gene is broken. So tumors can enter in, and it puts me at a higher risk for cancers. Even if I were to, God forbid, get cancer, go through treatment, that mutation is still there. The gene is still broken. So it's not like I've lowered my risk just by going through treatment. So that's sort of the easiest way. It's like a break in the ladder.
I see. And does it affect women and men the same way?
So you can get this mutation, it doesn't play favorites, so male and female. However, with women, we tend to be more concerned about breast cancers, ovarian cancers, melanomas. There's pancreatic cancers. With men, it can manifest as well as male breast cancer, but also prostate cancers. So men aren't able to take risk reducing steps in order to decrease their risk for cancers if they have a mutation, whereas women are able to take risk reducing steps in order to reduce our risk of breast and ovarian cancer because we can remove healthy body parts.
Thank you. I learned a lot from your response here. And let's talk about your access to primary care, which is a crucial issue in Canada right now.
Yeah.
How did you access, or how did the access or lack of access to primary care impact your genetic testing journey, or what were the challenges that you faced when you were trying to access primary care?
So there are a few things, and if someone in your family has a hereditary mutation, it does become easier because they sort of can push you into the system. As you know, with the lack of healthcare professionals in our system, it's difficult at times to be able to get this genetic testing, especially for those who don't have family doctors. What I always say is if you are looking for some type of genetic testing and you don't fit into what the healthcare system feels as high risk, you have to start by doing your own due diligence like you do with any patient advocate. You have to write down all of the cancers in your family, and you have to look at your father's side and your mother's side. You have to get as much information as you can perfectly, and then you have to take that with you. Now, if you don't have a family doctor, which many people within Canada don't, I always say you start with a clinic. You come in with knowledge about what you're looking to get information for, and you have to sometimes be forward. If you really are concerned about possibly being at risk for a genetic cancer, you have to explore all your options. So whether that means you go to a clinic and you speak with a healthcare professional there, and then they can write you a referral to a genetic counselor or to the genetics department at the hospital. It doesn't always happen right away. I find that the best results come from those who are very direct and sort of push for what they need. Unfortunately, we have to be more of an advocate in today's day and age. Now, because I had all of these cancers in my family, I was able to get into the system. But there are many hospitals within Ontario and within Quebec and other provinces within Canada that you can work through it as long as you can get access to a clinic to speak with a doctor and express your concerns. There is no magic answer, as I'm sure you know, being in the health field, that I always say that the people that advocate for themselves the loudest are the ones that get the best response. And that's sort of why it's so important to be your own advocate, because no one will push harder than you.
Definitely. If you're your biggest advocate, then you'll be able to fight for what you need. So
Exactly.
Thank you so much.
And I should mention as well, it's our right as Canadians to be able to go for second opinions too. So if you meet with a healthcare professional that isn't giving you the answers that you need, it doesn't mean they're wrong. It just means that you are entitled to go see someone else. When I first talked about this mutation that I had healthcare professionals tell me that I should exercise and eat well. But that, you have to know what you're willing to accept from a healthcare professional, and then you have to go with your own gut as well. So
definitely educating yourself and then making sure that you're finding the right treatments for yourself and getting that help from your primary care physician or healthcare worker is very important.
exactly. And nurses are also really valuable. I mean, it's not just the doctors out there. You can use other healthcare professionals to try and push your needs forward.
Can you talk about the role of primary care physicians in helping patients navigate genetic testing and preventative options? What's working well at the moment, and what do you think needs improvement?
Well, I definitely think that we're learning more every year. And so I think with education comes better options. And I don't necessarily know if I fault the healthcare field for that. I think that cancer genetics are continuously growing, and, they're learning more as they go. And some doctors, if they've been, practicing for a long time, aren't up to date with all of the genetic cancers. It's a new field and they're constantly learning.
What barriers do you think people currently face when
Barriers.
accessing genetic testing and preventative care, and what do you think can be improved upon?
I think the first barrier that we as patients face is lack of genetic counselors and genetic doctors. It's really important when you go for genetic testing to not just go for a test and have the healthcare professional tell you, yes, you have high risk, or no, you don't. It's really important to speak with a genetic counselor who understands what all those risks are and what your options are, because it's quite scary to hear that you're given, for example, like I was given an 87% chance of developing breast cancer. That's really scary to hear that. And if you're not given the right tools in order to understand what that means, people tend to get very overwhelmed. So it's really important to have access to genetic counselors, and not all healthcare professionals push that discussion. So I think that's really important, that anyone who's undergoing any type of genetic testing absolutely must meet with a genetic counselor before their test and after their test. And as someone who has gone through that process, it's important to ask for that. And I don't know if there's enough genetic counselors out there yet that are learning, because it's an ever-growing field. So I think that COVID definitely played a part in pushing things back. So we're already behind with, diagnoses. And I think it's really important to be able to push for what you need in the health system, even if you're not getting the answers you want, just to be seen, because as we know, we're lacking so much of that. But I find the biggest barrier is access right now to genetic counselors to fully explain what all of these results mean. And so it's important to have the healthcare professionals work with the genetics department to know that they should be a team. I think that that's a barrier they really need to work on right now.
Definitely. And we truly believe that family physicians working in teams help patients find the answers that they need faster and in a more comprehensive answer as well.
Absolutely.
So love that
And
you're bringing in the team aspect.
well, that's it, because I mean, I've sort of built my own healthcare team around the doctors and nurses and oncologists that I trust and value. They don't have to have all the answers. They just have to be open to hearing what you have to say, because it's your own lived experience, and be open to working with other teams in order to be able to provide the best results that you can get.
For sure. And speaking about your lived experience, after discovering your BRCA2 mutation, you made the decision to undergo several preventative surgeries, including a full hysterectomy, oophorectomy, and double mastectomy with reconstruction.
Yeah.
Can you walk us through how you came to these decisions and the role the healthcare team played in this process?
Sure. So I didn't know much about my family history, but when my father tested positive for this mutation, I started looking into it, and I realized that all the women on my father's side of the family had died of either breast cancer or ovarian cancer in their 40s or 50s. And I even had a first cousin who has this mutation who had a lump in his chest. Thankfully, it was nothing. I have an uncle who has melanoma, which again also is one of those cancers that is a high risk. So when I found out that my father was positive and then I went testing, I've always been proactive. I've always been black or white. I'm not that person who has to think hard about things. I was a young mom. I was like 32, newly married. My kids were 2 and 4. And all I kept on thinking is, my father lost his mother when he was 16. I don't want my children to lose their mom. So I was driven by fear. As soon as I found out that I had this mutation, every lump in my chest felt like breast cancer. Maybe I ate too much and I had like a stomach ache from eating too much. I thought it was ovarian cancer. So I was driven by fear. I was thinking, if I don't remove my ovaries and my breasts, I'm going to get breast cancer or ovarian cancer, and I'm not going to see my children grow up. So I was driven by fear, but I was also driven by confidence, knowing that removing these body parts would drop my risk down to, less than the general population. So that's what drove me. I wasn't afraid of the surgeries. I was afraid of the pain, and I was afraid of what I would look like afterwards, especially post double mastectomy. But because I had such a good life, and, I just didn't want cancer to devastate my children the way that cancer devastated my father's childhood. And so that's what drove me. I also have an amazingly supportive husband who, when I said I'm going to do this, said, obviously, we just knew we were going to do what we can. And this was 15 years ago. Nobody was talking about risk reducing surgery. So I was really on my own. I was feeling quite alienated because breast cancer patients weren't having to make the same decisions that I was making. I was having to make these decisions on my own. So I was confident with my decisions, but afraid of the surgeries and recovery. Never once have I had any regrets about making these decisions. It's 15 years later. I'm here. I'm healthy. My kids know I'm here. My husband's been nothing but supportive. And regardless of everything I've gone through, I would never change what I've done.
Thank you for sharing your story. It sounds like you had a very supportive family with you during this difficult time. And so I'm glad that you had them there for your journey. So talking about building a community, this experience led you to create the BRCA Sisterhood, which now has over 10,000 members.
Yeah.
What inspired you to build this community, and what role does peer support play in the hereditary cancer journey?
Great question. So I started this support group with a friend that I met online 13 years ago because I was faced with all of these questions and nobody to talk with. I either had people telling me to exercise well or eat healthy, or, if you get cancer, just go for treatments. But those weren't logical responses to my own personal decision-making process. You can't just trivialize what I was given. I was given an 87% chance of getting breast cancer and a 44% chance of getting ovarian cancer. So I felt so alone, and I did have some support. Some doctors thought I was silly. Some doctors supported me. I even had to come with documentation to my healthcare professionals to say I'm not being unreasonable. But I felt like I was always fighting for myself. I just wanted to speak with somebody else who was faced with those decisions, who got it and didn't judge me. And so I started searching online, and I found a few women from all over the world who were undergoing the same risk reducing surgeries, and we all felt quite alone. So I decided with a friend that we were going to start a Facebook support group to speak with other peers, so that when I said, well, I'm not afraid to do the surgery, but I can't imagine looking at myself in the mirror after surgery and having no breasts, for someone to actually say, oh my God, that's how I feel. And I realized that peer support is not only there to emotionally support you, but it's also to be able to share ideas and experiences and tips and tricks and things that nobody else would tell you unless they have another lived experience. So I started reaching out to healthcare professionals and genetic counselors in Montreal and Ontario, and started telling them about this support group, and that it was not run by medical professionals. So there was no medical advice that you were getting. It was really just support from others. And it just kept on growing. And then it sort of went to the US, and now I've just created connections with other hospitals and, wellness centers throughout North America and overseas, and people who just want to talk with others who get it, come and join our group. And there's no judgment, and somebody who's undergone a risk reducing surgery can tell somebody who's doing surveillance, that's okay. You just go regularly. You're doing what's best for you. So there's no judgment. We all have lived experiences. We all handle it differently, but we all understand the core feelings of each other because we're all faced with those similar diagnoses. And so now we have, administrators that are others who are diagnosed with a hereditary mutation. And it's all just about support, making sure that no question goes unanswered. Oftentimes there are people looking for, plastic surgeons in certain areas, so people will pop in. It's really just about love and support and no judgment. and it's just going strong. I always have requests every day, and people find it a safe space.
That sounds like a beautiful community. Thank you so much for starting such
Thank you.
a strong and empowering
Yeah.
community that supports everyone going through cancer risks.
And I should mention that a lot of these women have been diagnosed with a breast cancer or an ovarian cancer before they had any idea about these mutations. So we have those in the group as well, because they're still facing similar decisions, even though they have a cancer diagnosis. They still have other decisions to be made because of other high risks.
And just going back to your surgery experience, how difficult was it to maybe not convince, but tell your doctor that you wanted to go through these preventative surgeries? And was there any pushback from your doctor or your healthcare team on making this decision?
I did go to one family doctor who said that he thought I was being ridiculous and that he wouldn't necessarily support that. So I just knew that doctor wasn't for me. When you go for genetic testing and you test positive, you're in a good place because the health establishment that you're with understands that you do have this high risk. And although you don't have a breast cancer or an ovarian cancer, they treat you at such high risk that you go into the system. So because I did all my genetic testing as well as meeting my doctors through the same hospital, I was quite supported by that whole community that had built around me. There were other doctors that definitely didn't agree with what I was doing. And even if you meet a plastic surgeon or a breast surgeon, they don't always have the same beliefs you do, So you still have to be upfront about what you want with your surgeries and reconstruction. And so that was really important as well. But when you go through the genetic counselor system, it's much easier to be supported by the healthcare community. Some people will go through DNA testing like 23andMe or color genomics. Those are not as accurate. They're harder to understand, and you're not actually getting a professional explaining to you what the answers mean. So if you come with an answer saying, I think I have a genetic mutation because I did 23andMe, it is harder to get into the system. You still want to go to see a genetic counselor, so you might have to push a little bit more.
And pivoting to your EMPOWERink group, you continue to advocate for hereditary cancer awareness.
Yeah.
What do you think are the most important things healthcare providers and the public need to understand about hereditary cancer risk?
I think the most important thing to understand is that if you have any concerns, it's important for the healthcare professionals to make sure that they talk about family history. That's key when you're dealing with genetics, is that it's important to know your family history. It's important for your healthcare professionals to have it marked down so that they see. So I think that is extremely important. And, genetics is ever changing. So it's such a new field. I mean, even though I've been living this for 15 years, they're discovering so much as they go that it's hard to say it because it's such an ever-changing landscape. I think the more they learn about hereditary cancers and the more they deal with personalized medicine and personalized treatment, the more these hereditary cancers will play a part. And I know the original BRCA mutations, a lot of scientists are using those to start to understand the mechanisms of cancer and how it starts.
Just make sure that you go to your doctor with your full family history and make sure that you advocate for yourself and find the correct healthcare provider for you that aligns with your own values.
Exactly. And it's okay. Not every healthcare professional is going to agree with your decisions, and that's okay. But as a Canadian, we have the option to say, okay, I respect what you're saying, but now I want to speak with another doctor to see what they have to say. I always say, we buy a car and we get a second opinion on everything. And then when it comes to our own health, we're so worried about getting second opinions, but there's nothing wrong with that. And any healthcare professional who's not comfortable with that, that's their problem, not yours. And no disrespect. It's just we're allowed to talk with different healthcare professionals to get different opinions to decide how we want to navigate.
Yes, for sure. And that definitely goes back to being your own biggest advocate for yourself.
Exactly.
Um, to wrap up, Karen, what message would you like to share with our listeners who might be dealing with hereditary cancer risk, either personally or through a family member?
Well, the most important thing I always say is ask questions. And if you're not getting the answers you want, don't be discouraged. Ask somewhere else. I also encourage anybody who is curious about any of these hereditary cancers, write down questions, write down notes, reach out to people who might have a lived experience, and get as much information as you can in your hands before you make that first appointment. I always say it's good to treat your doctor's appointment almost as a business meeting. You come in prepared and professional and make sure that everything you want to discuss is in front of you, because you tend to get a little bit overwhelmed. And if you're not getting the answers you want, yes, it's frustrating, but it has nothing to do with you. Every doctor is just a person, and they've all learned in a different way, and they've been taught in a different system. And not everybody is going to align the same way, even if you are an MD. And so it's really important to feel confident, polite and respectful, but confident enough to say, listen, I appreciate your opinion. Now I'm going to speak with somebody else and see what they have to say. And so there's, the old school way of thinking is doctor knows best. But as a patient, we are learning that our voice matters too. And so there's a way for you to advocate for yourself or a loved one in a respectful manner to make sure you're getting exactly what you need. And you don't have to worry about offending somebody, because it's your life and it's your body, and you're the most important.
Thank you, Karen, for sharing your powerful story and insights
Thank
with us
you.
today. And to our listeners, thank you for tuning in to Prescription for Primary Care. We hope this episode has shed some light on the importance of understanding hereditary cancer risk and the power of proactive healthcare decisions. Until next time, wishing you good health and better healthcare.